Assalamu alaikum. Today, we will learn about the intricate anatomy of the human shoulder joint and precisely why shoulder joint X-rays are routinely performed. This prominent bone here is the clavicle, also commonly known as the collarbone. A significant fracture can be clearly observed in the specific clavicular area, indicating a potential injury. This particular articulation is the acromioclavicular joint, which connects the acromion and the clavicle. Next, we can distinctly see the acromion process, which is a bony projection of the scapula or shoulder blade. After that, we can clearly identify the rounded head of the humerus, which is the long bone of the upper arm. This is indeed the head of the humerus, a crucial part of the ball and socket joint. Then we can observe the upper course of the humerus bone, extending downwards from the head. Following that, this specific region is the surgical neck of the humerus, a common site for fractures. This small, distinct prominence is the lesser tubercle of the humerus, an attachment point for muscles. Next, we can clearly see the greater tubercle of the humerus, which is a larger, more prominent bony projection. Then we can identify the glenoid fossa of the scapula, a shallow depression that articulates with the humeral head. After that, we can observe the coracoid process of the scapula, a hook-like projection. Next, this elongated structure is the lateral border of the scapula, forming part of its outer edge. Then we can clearly see the inferior angle of the scapula, which is the lowest point of the shoulder blade. After that, we can identify the medial border of the scapula running parallel to the spine. This comprehensive view represents the AP X-ray anatomy of our complex shoulder joint. We perform this essential X-ray for various important medical reasons and diagnostic purposes. In this particular X-ray image, what we can clearly discern is a significant fracture located within the clavicular area, indicating a break in the collarbone. This X-ray examination is primarily and commonly done for critical reasons such as diagnosing shoulder joint dislocation, identifying various types of fractures, and assessing other related musculoskeletal conditions. In this specific X-ray, an AP or anteroposterior view of the joint has been meticulously taken to provide a clear perspective. Here, we can distinctly see a fracture in the clavicle bone, confirming the presence of a break. The proximal humerus, the clavicle, and the scapula are all clearly visible and assessed in this image. In this X-ray, a fracture can be clearly seen, indicating a break in the bone. Furthermore, a dislocation can also be clearly observed, meaning the bones are out of their normal alignment. That is precisely why we perform this crucial X-ray examination. There are numerous and diverse reasons why we critically need to perform this specific X-ray procedure for accurate diagnosis and treatment planning.